How effective are non-medication treatments versus medication regimens for ADHD symptoms? Introduction. Attention Deficit Hyperactivity Disorder, also known as ADHD, is a very prominent issue within our society. There is an estimated 6.4 million U.S. children who have been diagnosed with ADHD, which accounts for approximately 11% of United States children. Diagnosing ADHD is extremely difficult, and it is even more difficult to treat. The most common treatment for ADHD is methylphenidate, which can be extremely addictive. As a group, we agree that this is an issue that must be addressed. We feel that there is a better alternative treatment for ADHD that does not involve giving addiction-forming drugs to almost 11% of our youth. In this research, we will explore alternative treatment options and compare their effectiveness to the overly utilized medication options. The theory we are using to guide our research is Bronfenbrenner's ecological theory, which states that human development is influenced by the different types of environmental systems an individual is in. The microsystem, mesosystem, ecosystem, macrosystem, and chronosystem all contribute to how an individual acts and behaves. Our research is fueled by this theory. Research will show just how important environmental factors are to human development. Literature review. Theme 1. Research on using non-medication regimens over medication. Example. Alternative treatments for attention deficit hyperactivity disorder. Does evidence support their use? In this article, neurofeedback, diet, iron supplements, homeopathy, herbal medicines, and dietary supplements are reviewed as effectively treating ADHD. The results of this research overall show significant improvements in attentiveness and impulse control with neurofeedback therapy. Diet results showed 24% of the 49 subjects demonstrated an improvement according to the outcome measurement used. Homeopathy therapy results showed that 57% of the subjects displayed significantly fewer behavior problems. Essential fatty acid therapy displayed significant reductions in inattentive and hyperactive behaviors based off of a revised checklist, but that there was no significant improvements noted by the teacher's measures. Comparing pharmacological versus non-pharmacological treatment of ADHD in children and adolescents. This article that we used was the Pharmacological and Non-Pharmacological Treatment of Attention Deficit Hyperactivity Disorder in Children and Adolescents, Protocol for a Systematic Review and Network Meta-Analysis of Randomized Control Trials, in an article that was published by the National Institutes of Health National Library. In this article, over 26,000 children and adolescents with ADHD completed together 190 randomized trials. Non-pharmacological forms of treatment included behavioral interventions, cognitive training, and neurofeedback. Pharmacological methods include stimulants, non-stimulants, antidepressants, antipsychotics, and other unlicensed drugs. The results had found that behavioral therapy in combination with stimulants seemed superior to stimulants or non-stimulants. Theme number 3, comparing behavioral treatments versus a combination of behavioral treatments with medicine regimens. For this example, we used behavioral versus behavioral and pharmacological treatments in ADHD children attending a summer treatment program, which was written or published in the Journal of Abnormal Psychology in 2000. In this article, a group of researchers designed an intensive summer treatment program to study if behavioral treatments could be as effective as a combination of medication regimen with behavioral treatments for children with ADHD. At the camp, 57 children received combination treatments and 60 children received only behavioral treatments. The children were assessed on 35 different measures, and the children that received combined treatment were significantly better at rule following, good sportsmanship, peer negative nominations, and teacher post-treatment ratings of inattention and overactivity. While not significantly increased, the children that received combined treatments also rated as more normative in 6 additional measures. Identified gaps. In the research that we have conducted, we have found previous research on our topic, but we have yet to find research that identifies the long-term effects of pharmacological and non-pharmacological treatment. The research shows that some of the treatments can be effective for several weeks or several months, but are the same treatments effective for the long term? Statement of the problem. According to the Centers for Disease Control and Prevention, attention deficit hyperactivity disorder is one of the most common neurodevelopmental disorders that manifest in children, and it is estimated that there are more than 6.4 million children in the United States alone with this diagnosis. ADHD is not only a significant hurdle for individuals and their families, but it is estimated that the annual cross-sector cost is $38 to $72 billion dollars, making this disease a public health concern. The problem with ADHD is that it is a far-reaching disorder that affects families and individuals every day and is increasing in its prevalence every year, proving to be a relevant concern for current and future families and those that are tasked to work with those families. The number of ADHD diagnoses increased 16% between the years of 2000 and 2013 and has shown to continue increase in an upwards trend throughout the years. The purpose of this study is to determine if there is a better alternative treatment so that we are not harming our children and preventing them from having a happy and healthy life. The study is important because it will also allow us to determine if prescription medication is necessary for treatment of ADHD. Prescription medications such as methylphenidate are currently being used as treatment for ADHD, have potentially negative long-term effects. The types of non-medication treatments that we would like to examine include behavioral therapies such as meditation, breathing, and equine therapy. Alternative treatments such as diet, iron supplements, homeopathy, herbal medicines, and dietary supplements are viewed as effectively treating ADHD. For procedure, we will be treating third graders that are diagnosed with ADHD. The trial for participants will last a total of 40 weeks. Treatment will begin at the beginning of the school year and conclude at the end of the school year. There will be 3 groups participating in our trial. The first group will be given a variety of behavioral therapy techniques to help with the diagnosis of their ADHD. Behavioral therapy techniques will be taught by licensed professionals to those faculty members as well as family members. The second group will strictly use medication. Medication will be prescribed by the participant's doctor and will be based on what the child needs. Medication will be distributed by the school nurse at the same time every day for the 40-week trial period. It will be necessary that the parents continue to give their child the prescription at the same time that the school does on days that school is not in session. The third group will be used as our control group, and none of the participants will receive any treatment. The control group will allow us to have a baseline that will better gauge which treatment helps more. This will allow for us to determine what treatment is causing which results. The participants in this study will be third graders that are between the ages of 8 and 9 years old. The recruitment process will be done through the public school system. Participants will be required to be formally diagnosed by a licensed professional. It is important for the integrity of our study that the participants not be currently undergoing treatment for ADHD when the study begins, as this may skew the results of our study. The use of a questionnaire will be the type of measurement being used. It will be given to those who interact with the participating child routinely, such as a primary caregiver, teacher, social worker, therapist, and school counselor, will be asked to respond truthfully based on their experiences with the child. The study will last the duration of a school year. At the end of the school year, we will apply the questionnaire for a second time to the consenting child participants. From the second questionnaire score, the results will be combined with the results from the beginning of the school year. The results will allow us to determine how time and treatments affect ADHD. We believe that this method will provide us with the sufficient results to answer the research question. The research design is experimental due to the fact that it will include a pretest, a post-test, and randomized control trials. Our dependent variables will be the participants' behaviors. The independent variables will be the ADHD treatment that each participant receives, whether it's non-medication behavioral therapy or an ADHD medication regimen. The central question to be examined through our research is, which is a more effective long-term treatment for ADHD, a medication regimen or behavioral therapy? The hope is that this research will benefit the lives of children with ADHD as well as their families by providing them with an effective course of treatment so that they may combat the immediate and long-term effects of an ADHD diagnosis. The study will include a questionnaire that will help to determine the initial baseline. We believe that it is crucial for this research to be completed, and as it will have a massive impact on our society. For this reason, we would like to begin this research as soon as possible so that we can publish our results and help our society become great. And I accidentally skipped to the references ahead of time, but these are our references that we use, and they're all listed underneath.